moderator, and what a beautiful Friday morning we have here. I can't believe it's December 11th already. Go ahead here and get to our agenda. So several things to talk about today. We'll review healthcare reform updates. We'll talk a little bit about the under 65 market, the over 65 market, employer groups. I want to touch on SHOP again just for some clarifications, and then we'll make some announcements. And then, of course, as always, open it up for questions and answers. Let's start with healthcare reform updates. You know, the thing that I think is most important right now is for those of you that play in the employer space, I know we've been talking about this to our employers, but that the deadlines are coming, and regardless of whether they are in that transitional relief or not, whether they had to comply by 2015, 2016, et cetera, they still need to report. So we're looking at the employer reporting requirements due by February 29th or, of course, March 31st if they're filing electronically. So I think most of you have dealt with this already for your employer groups that are 50 full-time equivalents or greater. We've had a relationship with ADP. We've also introduced a relationship with Paylocity. And most recently, we've even worked with an agent that wanted access to a firm that does nothing but report. They don't have to change the client doesn't have to change their payroll system. They just have another firm that they can contract with that actually do the reporting for them. If you have a client that is talking to you about they don't want to switch their payroll system, they want to be able to do the reporting, you know, with another company that can actually complete the forms accurately, et cetera, and get them in on time, and they want to work with them, and they want to keep their own payroll company, as I said, or their payroll software, let us know. Specifically, let me know, because I've been working with a firm, and there's nothing in it for KHI. We just refer this business to try to get that client handled. So this whole reporting thing, I don't know about you guys, but when you hear some of the political comments going on right now about easing the burden placed on small businesses, this is one of the areas, of course, that gets highlighted and targeted. This has been such a burden for employers. And if they remove the employer shared responsibility, and that's what that ESR is, remember, for those employer shared responsibility for those that have 50 or more full-time equivalents, if that gets repealed, all of this would go away. Remember, too, that this reporting is really all about, we used to call it pay or play, if you recall, and it's all about reporting to the federal government that me as an employer with 50 or more full-time equivalents, referred to, as you know, as an applicable large employer, I'm being held accountable to the employer shared responsibility provision of the Affordable Care Act. I'm reporting that I have offered coverage or I have not to all of these people, and then they list their employees. And then remember, the second part of that form, the 1094 is really that employer form saying here's what I am or am not offering. And the 1095s are all of those forms that go to the employees. And if you recall, this now ties into the individual mandate, meaning every American, unless, of course, you have, like, you're incarcerated or you have, there's a couple other caveats that would allow you to get out of that. But in general, every American must purchase health insurance or pay a penalty. And so that's what that 1095C form is. And it's sending it to every single employee that ever was offered or had coverage on your plan in 2015 now that we're talking about in 2015. This form needs to go to those employees so that they can use that form to file with their tax return when they specify whether they've had coverage or not, okay? Remember, too, if somebody's not on an employer group plan, they have an individual plan, for example, then those forms will be generated by the by the health insurance company, like if you have Wellmark or if you have Coventry. And that, if you recall, last year was kind of a cluster, if you will, because Wellmark was trying to drive people to their website to get their form, that they weren't going to mail it out. So more to come on that. I'm sure we'll be hearing more about how individuals get their forms. And generally, I know most of the carriers are trying to drive their members to the member portal on their website to download their form. So we'll keep you posted as we hear more about that. So this Operation Shout Out that NAHU is really promoting right now, and I got to tell you guys again, this is my little plug for health underwriters. If you're not a member and you make a decent living in the health insurance industry, even though you might belong to the Big I or NAIFA, I'll tell you something, NAHU is the one that health insurance is its only focus. And we at KHI, we support those other organizations as well, but NAHU in particular is the one that is really focused, and so I believe they were instrumental in the whole definition of small group being repealed. And if you recall that did happen in October 7th, that was signed. We talked about that at last month's conference call. So this one is really about trying to remove the Cadillac tax. And if you'll notice, there's a couple things going on before our legislators, representatives, senators, et cetera, are to go home for Christmas break or for the holiday break, and that is the omnibus spending bill as well as the tax extenders bill. And there's two things going on right now. So they're trying to get language in there in one of those bills to repeal the Cadillac tax. So what they're encouraging, and thus KHI is encouraging you to reach out to your representatives to let them know that you support removing this, that this is detrimental to, I mean, we're talking about, I've heard so many people talk about, you know, the Affordable Care Act and where's the A in Affordable Care Act, and you guys have heard me talk about that. We can't find the A in Affordable Care Act, and this is one of those things that's going to continue to drive up the costs for those that, you know, that, and I don't know if you guys have looked at the numbers, but they just seem unrealistic because they're calling a Cadillac tax anything above a certain premium amount for an individual or for a family in a given year. And with the rates and the way premiums have gone up, it's just, anyway, it's ludicrous. That's 40% tax would be above and beyond whatever their premium is that they pay. And anyway, so just watch for that. KHI may even be sending something out for you to focus on this and be able to click on a couple links and contact your representatives. So be watching for that. So that's just a big deal. I shared last month there's a lot of other things legislatively that are pending, like trying to move the full-time work week from 30 to 40, et cetera. This seems to have gotten to the top of the pile most urgently now. So we'll keep posted. And then on another note, I'll just share that that as a president-elect of Health Underwriters for our Iowa chapter, I am attending Capital Conference again this year, February 22nd through the 24th, I believe. And just want to let you know, so I'll be bringing back updates from that as well. And we'll get, I'm sure, new news on what's priority for NAHU for all of us for 2016. So let's touch on the under 65 market. So the open enrollment deadlines, and I know we're all familiar with this, right? But we must get applications submitted by December 15th for a January 1 effective date. And the December 16th then to January 15th would give you a February 1st effective date. And then the 16th through the 31st of January would give you a March 1st effective date, give your client that. So just remember those deadlines. And I know the 15th is a Tuesday, and do everything online whenever possible, so that especially if you're getting close to that December 15th deadline. Also, I want to remind you, don't forget, when you're taking a client from one carrier to another, don't forget to help them get that other policy canceled. And generally, you don't want to do that till you know you've gotten your application in and some kind of a confirmation that, hey, we received your application, good for January 1 effective date. And you do have time to get that form in, the cancel form. Generally, with most carriers, it's, you know, by the first of the month of the date you want canceled. So we'll want to make sure we get those cancellation or change forms in by the end of December for a January 1 effective date. And one other thing I just learned with over the last couple of weeks is, and I don't know if you guys are seeing this or not, but when people are, Wellmark clients especially right now, are getting their renewals, this one client that actually called me and said, I can't do this, right, and what are my options? And they are actually moving to Coventry effective January 1, but they want to keep their Blue Dental. And so just a reminder to you that there is on the change form And it matters whether they're ACA or non-ACA, the different change forms. They're on our website on KHI Agents, but you can certainly holler at our team if you need help to find the right form. But this client wants to keep their Blue Dental. That's only, what, $23 a month and some change, I think. And the Delta Dental, if they went standalone, would be $35 a month for a comparable plan. So just know that that is a possibility for those that do decide to leave Wellmark and go to another carrier, but they'd like to hang on to their Blue Dental. They can do that. I'll tell you, UHC, I'm disappointed, I think, to say the least, in UHC. Now, some of you maybe never got contracted. Some of you talked about us, would you, should we get contracted? Most of you are all contracted with Wellmark, and some of you have picked up Coventry. And I certainly encourage, if you haven't picked up Coventry yet, you really need to pick up getting contracted with Coventry sometime this year, in 2016, because I just think, we don't know what's going to happen in 2017, but we know that it's going to be a storm. All those Wellmark clients are going to be forced to move to Affordable Care Act plans, and most of your clients are going to be asking for, what else can you offer me? Even if they don't take it, they're going to be asking. And I was with an agent just yesterday with a client, very, very upset, and the agent was showing them their alternatives to Blue Cross. I hope you're using those tools because they have been helpful. And they were a Pool 5 client. We used that Pool 5 estimator tool so they could actually look and see what their alternatives are, that they could increase their deductibles. But you know what ended up happening? They ended up staying with Wellmark, but they moved to an ACA HSA plan, a qualified high deductible health plan. So that rate was somewhat very comparable to the Coventry rate that was an ACA. So my point is, even though they didn't go to Coventry, they were asking for other options, and with the agent there, we were able to show them some other options, and they ended up staying with Wellmark. So even if you're normally a Wellmark shop, you can't afford not to be able to show them what else is out there, okay? So now back to UHC. So when many of you wondered whether or not you should get contracted for UHC and Medica, and at the time, really, we didn't have much information. So we didn't know a lot we didn't know their rates. We were starting to learn about their plans for both UHC and Medica. Now, Medica is doing really, really well, very strong in Nebraska. They're very committed to our marketplace. Their commissions, I believe, are like $30 a month for that first year. I'm trying to remember. I think their commissions are flat. I think new and renew is the same. Don't quote me on that. I'll have to double check that. But Medica is very, very strong. Their rates in Iowa aren't great. So I don't think they're getting a ton of traction. And as you guys know, if you're in northern Iowa, they don't include Mayo Clinic as a standard. It's a backup, if you will. It's on an exception basis you can get Mayo. So that's got some people kind of concerned. So when their rates are maybe very similar to Blue Cross's, and there's just not that need then to move, all right? And people are saying, hey, I'll just sit tight with what I have. So Medica, we're like, hey, I'm glad we have it. I'm glad they're here. They're going to be here again. They're not messing around with us. But UHC, getting back to UHC again, they've removed plans from online quoting, as you guys know. They've reduced commissions up to, so anything you're doing with UHC, you want to get those applications submitted prior to 1/1 and be able to still make money on it, but they reduced them. They cut them in half. It was supposed to be 6%. Maybe they haven't cut them in half, but I think it was 6%. Now it's dropped down to either 3 or 4% on new, and then renewal was supposed to be like 4%, and that dropped down to 2%. So get your apps in if you're selling UHC. Get them in prior to 1/1 of 2016. Anything submitted after that, they're saying right now they're not paying commissions on anything that's submitted 1/1/2016 and later. So anyway, I'll just leave it at that, and there's just a lot of confusion around what UHC is doing. And I apologize that we don't maybe always have exactly the answer of the day, because things continue to evolve and change with them. So as soon as we really know what's what, and I'm sure we'll have the full story on what their plans are, sometime around the first of the year. But as you know, once you're committed to the marketplace, because I talked to our United Healthcare rep, once you're committed to the marketplace and they're in 2016 in Iowa, if they were to cancel those plans, they could not come back into Iowa for 5 years. So that's why you're seeing changes where UHC is still on the marketplace, right? But they're off marketplace is where they're making a lot of their changes. So just know that this is just very concerning to me. And so if you're offering UHC to a client, you know, it should be transparent to them that any of this is going on, quite honestly. Except that you would have seen in the newspaper probably a month ago, right, UHC made frontline headlines in many newspapers around Iowa. I know the Register had it and said UHC is contemplating not being part of the marketplace in 2017. So the fact they're even considering that in 2017 and now making changes off marketplace in Iowa, why? Because as you guys know, they're traded publicly and they're saying we're not making money on certain plans. So back to this part about why they removed plans from the online quoting tool, my rep flat out told us that the bronze plans that were still there at the time we talked about it, which now they may even be removed, I haven't checked lately, but the silver and gold plans were not profitable, and they removed those from the online quoting tool. And then if you recall, they moved to you can call our telephone line and we'll give you a quote over the phone if you really want the plans bad enough, because they don't want us marketing these. And then they went to, okay, we're not going to do it over the phone. You're going to have to send us an email. To now where I'm hearing is they're not giving us quotes at all. So anyway, stay tuned, and I guess I would probably, if you're having this kind of trouble trying to get a quote for a client, I would probably, you know, if it's off marketplace, if it's on marketplace and you're seeing it there, it's good to go. They have to stay there, and they don't want to pull out of the marketplace. As I said earlier, they would not be able to get back in for 5 years. So they don't want that limitation on them. So, all right. And I know, Brenda, you're also on the call, and if you think of anything else while I'm speaking during any of these parts, please just go ahead and jump in.
Can't think of anything else, Lynn. Thanks.
Okay. And I was just checking. I saw we've got a question already, and I just wanted to make sure it was nothing related to what we were just talking about, or making sure that you guys can still see my screen and hear me and everything. Okay, so let's talk about Medicare now. I'm going to switch gears. So yay, let's all ching our glasses and cheers that AEP is over, and we made it right through another season. So those dates, October 15th to December 7th. Remember now, what is coming up is the Medicare Advantage disenrollment period that runs from January 1st through February 14th. And for those of you that market those Medicare Advantage plans, you know, primarily this is for someone that has a Medicare Advantage plan and has decided to leave that plan and go back to original Medicare, which, what does that mean? It means then that they need to purchase a standalone prescription drug plan. So if somebody does have that, they do have between January 1 and February 14th to do that and purchase their standalone prescription drug plan. Here's the kind of anomaly here, that the Medicare supplements, as you know, if they go back to original Medicare and choose a supplement, the supplements are not guaranteed issue when they're not in their original open enrollment period, right? Or as long as they're not in their trial period with their Medicare Advantage plan. If they're in their first time they've ever taken a Medicare Advantage plan and they're in their first 12 months, they can get a supplement without answering health questions. Or if the Med Advantage plan goes out of business, there's a few other exceptions, and many of you see this. If you're doing your Medicare supplement enrollments, especially if you're doing them online, I'm sure it's on the paper version too, but we're trying to drive you guys to do everything you can online. It just is more efficient, less paper, more accuracy. So, but when you look at your Medicare supplement application, and I'll just use Wellmark as an example, it goes through all of these. For instance, does this apply to you? You know, and so just know that one of those, if you click yeah, that I am in my 12-month trial or whatever, then you'll say that it'll tell you you do not have to answer the health questions. But in general, right, supplements are not guaranteed issue. You must answer health questions in order to obtain either a supplement coming off of a Medicare Advantage or switching Medicare supplement companies. If I'm trying to go from Mutual of Omaha to a Wellmark, or a Wellmark to an Aetna, or whatever the case is. So, okay, so I just want to make sure that you're aware of that. And the enrollment dates could be changing for 2017. We'll keep you informed. last year at Capitol Conference with Health Underwriters, this was last February of this past year, we had a presentation around Medicare talking about, can we change these enrollment periods, because we have, as we just experienced and are still experiencing, all of the group renewals for the 12-1s and 1-1s are clustered right here in this same time period. We're trying to do Medicare annual election period and now the open enrollment for the Affordable Care Act. And so some conversation has been had about moving the Medicare open, or I'll call it the Medicare annual election period, and move it, instead of being October 15th to December 7th, they're talking about moving it more toward this Medicare Advantage disenrollment period, doing it after the first of the year. So we will definitely keep you informed on that as we hear of things. I think it's a lot of folks in our industry are trying to push for that, just because of also the holidays, and we know this, and also a lot of our folks going south in the winter. Well, guess what? January through March, they're still there, right? So I don't know what the answer is, but we'll keep you posted. And then I don't believe we sent this out yet in a news flash, if you will, from KHI, but the increase in Part B for 2016, there had been rumors that this thing was going to go up to $159, and it had everything to do with the budget, the Medicare budget, and how can they increase premiums for Part B when they're not increasing Social Security benefits. And there's this hold harmless provision in the law that says those that are drawing Social Security and on Medicare, they cannot have an increase in their Medicare premiums if they don't get an increase in their Social Security benefits. However, they were able to, of course, find a little workaround here. The hold harmless provision does not apply for those that are not currently taking their Part B, or for those that may be taking their B, but they're not drawing Social Security yet. So those folks, that hold harmless provision doesn't apply to them. So therefore, make sure in your conversations now, as you're talking to folks about aging into Medicare in 2016, that premium for Part B is no longer $104.90. It's now $121.80 a month. It's also going up for those folks who do not take Social Security yet. And so they're the ones that typically get an invoice from CMS for their Part B premium. Now remember also, and I didn't put it in here, but there's that adjustment for those that make higher incomes. And so that, if you haven't seen that, and I've got a copy of that, I guess, and we'll make sure that the staff has it as well, but you can Google it, the high income. It's the IRMA, right? It's the income related, let's see, IRM, Medicare Adjustment Act, or something like that, right? So it's adjustable income or whatever. So it's that for the folks that are high earners, they're going to pay that surplus on top of their Part B premium. So you got to check that too to see if that's been adjusted, because I think it might also be adjusted for 2016. Okay. And then also just one other note, and again, we'll put this all out in one of our news flashes. It's just, we've been bombarded just like you guys have with all your questions and us trying to help you. We haven't gotten this pushed out yet, I don't believe. But the Part B deductible in 2016 is also going up to $166, and that's for everybody. It doesn't matter, when you get onto Medicare. So $166, and that's up from $147. Many of you are big fans of Plan G, which I love G too. G is identical to F, except the client would have to pay the Part B deductible. Knowing that it's going up to $166, you look at your difference in premium from Plan F to Plan G. Wellmark now does not have a Plan G. They've talked about adding G, and I haven't heard that they're going to have that for 2016 yet, but hopefully they'll definitely have it by 2020, unless that law changes, right, that says no more first dollar coverage. And so anyway, so more to come on that, but just wanted to make sure you're aware of that on the Part B deductible, and of course that does impact folks on Plan G. Okay, so on to employer groups, and our employer group department, Tricia, Nakia, Sarah, had asked me to remind you guys that the deadline for the 1/1 renewals and for 1/1 new business is also Tuesday, December 15th. Does that date ring a bell? Yeah. A lot of stuff going on. So by Tuesday, December 15th, we've got to have it in, and we really are requesting all business must be submitted with everything that we need. There's a checklist actually on, I know, Wellmark's employer application, but and we'll probably be working up another, maybe even a standalone checklist, regardless of your employer group. But it's so important, and I'll make an announcement at the end of the call about why we're driving this and why this is so important. But please make sure you've got everything that you need to get that group done by Tuesday, December 15th, and be working with Tricia, Nikki, and Sarah to get everything in. All right. So we just don't want that employer group to miss their 1/1. All right, and we're still kind of talking about employer stuff and employer group coverage, so I do want to touch on the shop marketplace. I talked about this last month, but we've gotten more questions on this, so I do want to confirm that UHC is the only carrier in the shop for 2016. And I actually got out there, and if you haven't done this yet, and if just for your own training, is go out there and set up. You can get logged in as the agent, because they do offer this more of a broker portal on the shop. And so, but I actually went out there and I put in a couple of, and you can shop the plans, and I put in 2 employees, and I put in their dates of birth, and up pops the UHC offering. And so, of course, it matters too. You have to put your state in there. So in Iowa, UHC is the only carrier in the shop. And the reason that I think that you need to know what this is, so put this on your list of things that you need to do for your training for 2016, is to just make sure you get comfortable with the shop. And why do I say that? And unless this whole thing gets repealed, and I know that could happen, but that won't happen until sometime in 2017, most likely, right? It won't happen while this sitting president is in office. But I believe for small groups, you need to be familiar with what this is. You need to know why you would offer this. So there's really 2 reasons, and I've got it on this page and the next. The 2 reasons that you would even care about using the shop would be, 1, that the employer can offer employee choice. They can go in, and if there's more than one plan and or one carrier, if there's more than one carrier or more than one plan, which clearly UHC has more than one plan out there, but the idea would be that it gives the employees choice. The employer then contributes a fixed percentage of a particular plan or plans that they have chosen, or they would say, we'll pick a metal level and we'll pay a percentage of a metal level. And that only really works well if there's multiple carriers out there. Wellmark has said today that they may be on the marketplace in 2017. Due to their market share in Iowa, if they say yes to the individual marketplace, they also have to be on the group marketplace, the shop. So that's why, if this happens, you guys will want to know what this is, because you'll have employers that are asking about it. And the second reason, I'm going to flip to my next page here, the second reason that somebody might want to do it is because of the small business health care tax credit they talk about. This is a credit that an employer would get for 2 consecutive years, but that's it. So if they've already gotten it, then this isn't the reason that they would purchase on the shop. They would purchase on the shop for employee choice, and it's really not there right now. So I'm not surprised that people aren't like beating down the doors to purchase on the shop right now, but I think we need to be ready in case Wellmark's on in 2017, that we're familiar with it in 2016. We've navigated it, we know what it is, and it's going to be able to, and just think of it, what if when Coventry finds out, Aetna, now Coventry finds out, or Aetna, soon to be all branded Aetna in 2017, Aetna Coventry, when they might decide they want to be on the shop as well. So now think about that there could be 3 different carriers, and if you said to somebody, I'll give you silver, you pick a silver plan, and I will pay, 50% or 70% of it or whatever, that just gives more choice, more options to the employees. So, okay, so enough about that, but that has to do with the tax credit, and again, it's for these small businesses. And let's just, review this really quick. This only applies for those with fewer than 25 full-time equivalents and that their full-time equivalent wages average less than $50,000 a year. And remember, in this, they take out the owners and family members of owners. They take them out of this calculation. But so even if you're below that, so this really is targeted for small groups. The sweet spot to get their full premium credit, this tax credit back, would be with those that are at 10 or less, and whose wages are $25,000 or less. So they might not get the full 50% credit on what they've paid. So if they're paying 100%, they're going to get 50% back. If they're only paying 50%, they're going to get 25% back. Are you with me on that, right? So anyway, I just think, don't mean to beat this thing, but I think you need to be comfortable with it and familiar with it. So please put that on your little training plan for 2016 to get in there and mess around with it a little bit, all right? Let's touch on some announcements here, and then we'll open it up for questions, and also, of course, open it up for Brenda if you have anything else that you want to make a comment on. So I mentioned earlier about submitting individual applications online and also submitting all information on employer groups. So obviously, we'd like this for any carrier, right? It makes it easier for you. It's more efficient for everybody involved, and the client is, et cetera, gets their cards faster, et cetera. But here's also, let's share with you why. Because we are evaluated every year on certain components. And last year, remember, they had the survey, and we were just dogging you guys about filling out the survey for us because we're evaluated on, yes, the results, but we had to hit a certain response rate. So we care about the results, and we hope that we're doing a good job, but we just wanted you to complete it because we needed to hit a certain level of responses. So the other thing last year was things like new sales and retention rates, right? Well, in 2016, Wellmark's come out and said, you know what, we're not expecting a lot of growth in 2016, so we're going to look at a few things like retention, but we're really going to focus on, are you submitting things electronically? And so in the individual market, there's a mandate now that Wellmark have everything, individual applications, submitted electronically. Now, will we hit 100%? No, but we're going to push for 100%, and we hopefully will get, at least 90%. So you're going to notice that we're going to be reaching out to you if we receive your applications today on paper. And we realize that not everything can be done electronically, but there's a little mark, I believe, on the application that says you can submit this online for me, right? There's this little, I think there's either an attached form, and that's where, Brenda, you might chime in, because I know we've talked about this with our Wellmark rep. But go ahead, Brenda, if you know that one.
Yeah, there is a box on the ACA. So you cannot do plan changes for the old plans online, but what we're referring to is any new ACA plan. So new business, or also anyone that's going from an old plan to an ACA plan, you can actually do online, and that application does, like Lynn was saying on the last page, has a box. So you can sit down with the client, do a paper, and then turn around right away and put it online. And like Lynn said, Wellmark's doing a huge push to all the general agencies to make sure that the agents are doing them online, because they really want a good member experience for their customers. That's why they have the deadlines that they do. And when you do it online, it's so much faster, obviously, for your customer and your client to get their ID cards.
Great. Thanks, Brenda. So we're really going to be continuing to encourage that. We'll reach out to you if you're one of them that likes to do paper. We'll help you through how you can help us with that, okay?
And Lynn, another thing too, if you want us to help, if our gals can help you, if you have an assistant in your office that could maybe do this for you, we'd be more than happy to walk them through it, because it's actually very, very easy, especially if you have the hard paper application right there in front of you. So if you don't have time to do it, but you have someone else in your office that helps you with the paperwork, let us know, because we'll certainly walk them through that process.
Great. Thanks, Brenda. Okay, I'll move on to Medicaid. I had an agent ask me to specifically touch on this, that they're getting asked, and I think there is confusion. How many times have you said Medicaid and you meant Medicare, or vice versa, right? And so just to be clear, Medicaid is for low-income beneficiaries in Iowa, as you know, when they're at or below, and it actually went to 138% of the federal poverty level. That's the Medicaid expansion in Iowa. And so what Governor Branstad wanted to do is to be able to I'll say privatize the administration of Medicaid in Iowa because he thinks that we can save money. And so I'm sure they went through some kind of evaluation to determine that. And many times, I mean, you think about it, that's what Medicare Advantage is. It's privatizing Medicare in essence, right? It's claims are not going to Medicare, they're going to the company that you've signed, that client has signed up with, like Coventry or UHC or Humana or whoever. And so here in Iowa, rather than us have government employees that are managing the Medicaid process, getting people signed up, facilitating all the claims, making the payments, contracting with the providers, all of that business is now being contracted out. And instead of picking one company, they picked 4 companies to actually do this business. And so what we're finding now and what we're seeing in the newspaper are what I call these issues of integrity, right, where there's been issues with some of the firms. Now, I'll be honest with you, because I don't, and we as KHI don't generally work in that Medicaid space. As you know, it goes into the government. And even I know a year or 2 ago when we talked about this expansion of Medicaid, many of us, we just don't play in that space. And we have to refer people anyway, like to the Department of Health and Human Services, DHS, right, when they are approaching that threshold of their pay. So that's all I know, and I haven't done additional research on it other than what you've seen in the paper and what I've seen. But I think at a high level you can explain to them that this is the strategy of what the state of Iowa is doing, and what this administration is doing is to try to save taxpayers money and contract the administration of this program out to these firms. And there's questions with some of the ones that have been awarded contracts. And I don't know about you, but you know what? We see this everywhere. We're seeing it at the national level, whether it's Benghazi, whether it's the IRA, or excuse me, the IRS, in how they treat some nonprofits. And I mean, it goes on. So, you know, we're not immune to it here in Iowa, and so I'm sure we're going to hear more about this. So that's all I guess I'll say about Medicaid in Iowa. And then the KHI website lockdown, and you should have seen that when you use the KHI agents website. And what we're trying to do, and we've talked about doing this, and we've finally done it, is we've gone ahead and locked down those portions of our web portal if you're not contracted with us for that carrier. So it impacts the carrier links and forms. It impacts, let's see, I'm thinking it also could impact the news section when we've got it labeled for that particular carrier in terms of searching for that carrier. So, but you'll just see, and if you hit that where you click on it and you go, hey, I should have this information, just let Nicole know. She had just done, and a big shout out to Nicole in our office who, and worked with Darcy as well, our director of marketing, and just really, really worked really hard to make sure we got this right. So we didn't shut you out if you shouldn't have been, but we have it locked out for those. And if you're locked out and maybe you're contracted directly with a carrier and not with us, and then please give us a holler, and we'd love to work with you. But it just made sense. We can't keep providing information to folks that aren't contracted with us. And anyway, so I'll kind of leave it at that. If you have any questions, again, you can give me a holler, any of our team members, but in particular, Nicole is handling calls on that. And then last but not least, before we open it up for questions, is Merry Christmas and Happy New Year. Our offices will be closed to celebrate with our families and to celebrate the birth of our Lord. That's just a great time of year, and I hope that you guys will enjoy that time of year as well with your families. And and then of course we're closed on New Year's. I didn't put that on there. So let's go ahead and open it up to Q&A, and I'll also just ask, you know, Brenda, if you have anything else that you want to chime in at any time, please do. It looks like we had an agent who's already left the call, asked a question at 9:11 and said, my clients keep getting letters saying they need to apply, and they have gotten mail that say they're signed up. I wouldn't worry about that. If any of you also have that question or concern, I wouldn't worry about that. I think your confirmation that you got signed up is what you need, and I think a lot of times people, you know, left hand isn't talking to right hand. So another question by Carol Weber is Coventry plan changes. Is the fax number at the top of the change form good? And that was the 877-899-6447. And I would say this, Carol, I would say make sure you get it to us, right? Get that to us so that we've got a copy of it and we can get it sent in, and we'll verify that that fax number is good. But if you can Scan and email that to us or fax it to us even, in our fax number, 515-576-6666. Just get it to us, and then we'll get that in for you, and we'll be able to track that form and make sure that Coventry gets it. Another question here by Mark McGill. Will those that are on Social Security now that don't have an increase receive an increase when Social Security does go up? And my answer to that would be yes. So those that are on Social Security now that are not receiving an increase, when Social Security does get an increase, if the government decides they also want to increase the Part B premium, then that will go up correspondingly. So that's when that hold harmless doesn't apply when there's an increase in Social Security benefits. So we'll kind of wait and see. So we know we heard this year there's no increase in Social Security benefits, therefore there cannot be an increase in Part B. But I'm sure it'll happen. You know, if it's not next year, it'll happen the year after that. So next question is, if a client is taking Social Security but does not have Part B yet, will they pay the higher cost? Well, and the answer would be yes, because if they're drawing Social Security but they have not activated their B yet, then I call them an age-inner, right? They're aging into, or they're maybe not aging in, I should say, but they're now taking their Part B. So if they're taking their Part B for the first time in 2016, they will pay that higher amount, even though they're drawing Social Security. So it really has to do with when they're activating their B. So if they're activating B in 2016, or they're aging in and activating B in 2016, regardless of whether they're taking Social Security or not, they will get that higher amount. Okay? Again, that hold harmless provision just says if you're taking Social Security and currently on B, your rate will not go up. But if you don't have those two things happening, then your rate's going up. Okay. Let's see, another question here by Sue. Seeing a lot of our Medicare supplement clients shopping the different markets available. What companies that KHI represents with the best rates? Lost a few to Oxford. Okay, when you go out onto khiagents.com and you click our Medicare supplement, and this is a great question, and I'll have to follow up with Nicole on that, you should be able to see the different carriers. Now, if you're not contracted with us, then you won't be able to probably open that information. But I'll have to verify with Nicole how far down that lock goes. But we have, for sure, we have, of course, Wellmark, Aetna, Equitable, Mutual of Omaha. Okay, I was trying to think.
AARP.
Thank you. Thank you, Brenda. AARP. And I think we still have Gerber, and we just don't do a lot with Gerber, but we have Gerber as well. So those would be the subs that we have. I think Medica even has a sup, and I wonder if is that the same as Oxford, Brenda? Do you know Medica?
No, well, Medica I don't think has anything here in Iowa. I know up in Minnesota they have some cost plus plans, and they're real popular up there. Can I just say something on the supplements? And if you guys are getting solicitations, or your clients are getting solicitations from other carriers, I guess one of the things that the story that I always tell is Mutual of Omaha several years ago came in, and their rates were quite a bit better than Blue Cross, and so a lot of customers switched. And then I guess what happened is, you fast forward 5 years down the road, and all of a sudden they started seeing rate increases every 6 months. And the people that are healthy, of course, can jump off and maybe underwrite and go to another carrier. But the risk these people run by switching to these other carriers is that they might not be able to switch back if they become unhealthy. And I've been doing this for 20-some years, and every year there's a carrier that comes into Iowa that's lower than Blue Cross, stays lower for a while, and then it kind of catches up to them, and they don't have enough market share, and then all of a sudden we start to see the rates creep up. So just, I always, when I sit down with a customer, I go through that, and I say, yes, we have all these other carriers. Can I look you in the eye and say that in the long run that's going to be the best thing for you compared to Wellmark? No, I can't, because I've seen too many times where people have been stuck on carriers that have had some pretty big rate increases because they developed a health condition and couldn't move. So just, if you have those customers, when you're sitting down with them, make sure you tell them you have the other carrier, so that protects you down the road if somebody else tries to get a hold of them. And also, if they're looking at switching to another carrier, look at the rating of that carrier. There's a lot of carriers out there that aren't A-rated carriers either. So I guess that's my 2 cents that I'll throw in there.
Great. No, thanks, Brenda. Okay, next question from Patsy. For ACA change forms, if they are postmarked by 12/15 of 15, is that okay for a 1/1/16 effective date?
Wow. My understanding is no, it has to be received by. That's why you have to do them online. You want me to double check with the gals, but I don't think you can do a paper app and send it in after. But let me go double check real quick, Lynn.
Okay, thanks. Now, and it's an ACA change form, so obviously they're on an ACA plan and they want to move to a different ACA plan. Okay. Okay, Brenda will check on that one, Patsy. I'll keep going on some of these questions, and then, yep, and here's another one. When you talk about getting contracted with Coventry, does that mean to be contracted with Aetna for under 65? Yes. So it's Aetna, it's an Aetna company. They own Coventry One is the brand on the under 65 products. So yes, that is under 65. And then Dean says, I switched 2 clients from Coventry to UHC on the federally facilitated marketplace. How do I know the application has been accepted by UHC before I cancel the Coventry plan? They are guaranteed issue, and they have not made any changes. UHC has not made any changes on the FFM about pulling off of the marketplace. So, and they should have received their confirmation online saying, congratulations. I mean, we've got your enrollment. So hopefully you got a print screen of that, or the client has. But you're good to go on the federally facilitated marketplace, Dean. Off marketplace is where it gets sketchy. Brenda?
Lynn, I did get, yep, I got verification that it has to actually be received by Wellmark by the 15th, whether it's a change to an ACA or a new ACA. So you can't do a paper and have it dated prior to the 15th and send it in. We have to have everything in on the 15th.
Yep. Okay, Patsy, get it to us so we can get it in for you, or whatever you need to do. But yeah, let's get it. Try to avoid paper at all costs. So let us help you by tracking that to make sure it gets in time. Let's see, another question here, Patsy. I was told that one of the Medicaid choices was a Wellmark product under a different name. Is that correct? If so, which one? I'm not familiar with that. I know I don't think Wellmark is in that Medicaid space at all in Iowa, but I could be wrong. And I don't know, Brenda, if you've heard of anything like that.
I have not heard Wellmark in that space whatsoever. I saw a list of carriers that were bidding on that, and I know Medica was one of them, but I didn't see Wellmark in that list at all.
Yeah, I think UHC.
And again, I might be wrong, but I never saw that.
Yeah, okay. I haven't seen Wellmark at all, so I would be surprised. So I don't think so, Patsy. And I think that some of the other companies, I think UHC has been a player in this space across the country with Medicaid, and so I wouldn't be surprised if they are there. And yeah, and Medica, I think, like Brenda said, had maybe put it in, but not Wellmark. Let's see, and then Tanya, I got your question here. If I sell on the marketplace a UHC policy, will commission be paid? And yes, commission will be paid. They're saying get it in prior to 1/1/16. So, and obviously you do if you're going to do something. Generally, it's by December 15th, but you have until, as you know, January 31 on the marketplace. So I would say, though, get it in. Make sure you get whatever in prior to 1/1/16, and you'll be paid commissions. They'll be reduced commissions, as they already told us they were doing that, but at least you'll get paid commissions. And another question, let's see, Patsy, can the change forms be faxed direct to Wellmark? My fax is not compatible with yours for some reason. That's bizarre, and I'm okay. Brenda, I'm gonna maybe check and see if our staff knows that. Can they be faxed direct to Wellmark?
Question?
Yeah, Patsy just said, back to that ACA change form, can it be faxed direct to Wellmark? Her fax is not compatible with KHI's for some reason. Like, wow.
I've heard that from a couple people in the western part of the state, but we get other faxes from that part, so I know it's not our machine.
Well, Patsy's down in the southeast corner of the state, so.
Southeast? No, I haven't not heard that.
Bizarre.
I don't know why it wouldn't be compatible unless, yeah, And then,
So
Patsy, you can also scan it and email it.
Yeah, can you scan an email? That would be best. But I guess the question is, can you fax the form direct to Wellmark? We'd still like a copy of it to be able to track it, but I would need to check with our staff to see what if Wellmark has posted a fax number where things can be faxed in. I know we're trying to move to either do it online or scan an email.
Right. Another reason to do it online on a new one. Now, obviously, if it's an old pool plan change, you have to do that on paper. But anything moving from old to new ACA or a brand new ACA policy, that's just one more reason to do it online. Because if you do it online, we don't need a copy of it because we actually can go out and pull that down and get it into our system.
Yeah, okay. And then looks like Randy's got a question here. Oh, a comment. Thank you, Randy. It's called WellCare, and it's not an Iowa company. So maybe the one that we're hearing talk about is called WellCare. So certainly not Wellmark. Sounds a little bit like it, but thanks, Randy. Okay, good stuff. What else? Let's see, another couple questions here. Does KHI want a copy of all the PDP apps that we did during AEP?
Yes.
Yes. Thank you, Brenda. I thought so, and I was like, before I say so.
Well, the problem is if we get commission and we don't know that you sold it, it's very hard for us to know who that goes to.
Yeah. So that would be good, and then our records are up to date as well. Because yeah, like Brenda said, when we get a commission run in, it'll try to look for that correct policy with the correct carrier. So yes, thank you. And it looks like another question here. Can I fax to KHI from West Des Moines, but snail mail work okay? Or I can't fax to KHI from West Des Moines, but snail mail works okay. I don't know what that problem is, but you guys, I would really encourage you to, if you haven't figured out how to, if you can't scan an email, maybe, you know what, wow, you could, I can do something in my West Des Moines office, and maybe if you can get it there and I can get it if you're having trouble. Okay, we've got to figure that one out, Brenda. I don't know what's up with our fax machine and why some people can fax to it and some people can't. So our fax number, as I said, is 515-576-6666, and it comes in and it converts it electronically to a PDF, which is fantastic because then we can just take those faxes and send them in, and then we've got the tracking. But anyway, again, I just caution on snail mail. Here's another question. If you replace an existing exchange plan with a different exchange plan, let's say same company, do you have to tell healthcare.gov to cancel the first plan? I got clarification on this, and Brenda, I'm going to ask you to confirm, but if you are on the marketplace and you sign them up for a different one, it's just almost like Part D, whereas you can only be enrolled in one plan. So when you enroll through the marketplace with a different plan, it will automatically cancel you from the other plan because it takes the most current application that you've submitted. And down to the next question. Can we sell Wellmark Dental if they don't have a Wellmark policy ever? And my understanding on that, and I'm going to see if Brenda can listen in on this question and then confirm my answer. But
well, can we go back to the first one because I just got clarification on that.
Okay. Okay.
Sorry, I'm running back and forth again, mute. But on the marketplace, what you said is correct, Lynn. If you switch them to a different healthcare plan, you don't have to worry about canceling the old one. It knows. However, if you have a Delta dental dental plan in there, it will cancel. You automatically have to, or they automatically cancel that dental policy, and you have to re-enroll them. So that's something that we've been running into. So just make sure that if they do have dental, that you re-enroll them, because otherwise it'll drop the demo off. Okay, so what's the next question?
Okay, so then the next one is, and I'm pretty sure I know the answer to this one too, is can we sell a Wellmark Dental if they don't have a Wellmark policy ever? And I think yes. The answer is no. Oh, it's yes now? It's dental.
Say that again.
Can they just
standalone dental? Yeah.
Standalone dental with Wellmark. So now they can. I think, yeah, for a long time they couldn't. So now you can get standalone dental. And what about standalone vision?
No, not the vision.
Yeah, okay. So just now they can buy a blue dental plan standalone if they don't have
Yes.
health policy with Blue Cross. Very good.
Yes.
Very good. Wow, good stuff, you guys. Good questions. Let's see if there's anything else. Yeah, great job, you guys. Yeah, I guess I can't think of anything else to add to that. And it looks like, yep, we just got a thank you there. And see if there's any other questions. Okay, I'm not seeing any more. So once again, you guys, Merry Christmas, Happy New Year. Enjoy the holidays. Once we get past December 15th, maybe we can all take a big sigh and take a deep breath until, you know, if we're still in the under 65 space for another month, but month and a half. But anyway, thanks again for your friendship and for your business, and we just appreciate all of you very much. So take care, and we'll be in touch again real soon. Bye-bye.